Okay, here in the United States, a record number of COVID-19 deaths were reported in the month of January. CNN's Natasha Chen now reports on the latest efforts to curb this virus.
What actions we're taking.
The CDC says starting Monday night, everyone over 2 years old using any form of public transit must wear a mask, even if one has already had the COVID vaccine. It's a mandate that comes a year after the first reported U.S. case of COVID-19.
We didn't expect to lose any of them, to be honest. We all thought they was going to bounce back.
This family lost 3 loved ones.
To wake up and know that he not there, I can't call him.
January was the deadliest month of this year-long pandemic. More than 90,000 people in the U.S. have died this month alone. And to give you some perspective, that's about 20,000 more people that could fit in this entire NFL stadium.
The Mercedes-Benz Stadium that hosted the Super Bowl just 2 years ago is now a vaccination site.
We can actually get more vaccines out given the resources that we have or that are shortly coming to us. But if you don't have the vaccine, then we can't do it.
Johnson & Johnson is expected to apply for emergency use authorization for its vaccine next week. Its global phase 3 trial results showed the vaccine is 66% effective, but 85% effective specifically against severe disease.
This is a single shot vaccine in which you start to see efficacy anywhere from 7 to 10 days following the first and only shot. It is very, very good with regard to cold chain requirements, namely requiring only a refrigerator.
Meanwhile, a new study suggests children are safer from the virus in schools than out of them. The author of the first detailed study of 2 K-12 schools said in order to reopen schools safely, they need federal centralized guidelines and better access to testing. Health experts are also eyeing new variants of the virus, including the first domestic cases of the variant first identified in South Africa and more than 400 cases of the variant first identified in the UK. Experts believe these variants will be more dominant by the end of March.
I believe that we should be treating every case as if it's a variant during this pandemic right now.
A pandemic that's far from over. The virus killed 9 nuns in a retirement home in Michigan, all within a few weeks.
It is numbing, and I do, a much deeper appreciation for all the other families who have gone through this, the hundreds of thousands of families. And until it personally touches you, I don't care how much we can have a sympathetic heart, it's different when you've already been there.
Natasha Chen, CNN, Atlanta.
Well, more and more people are coming forward with long-term COVID-19 symptoms, way beyond the average of a few weeks. Rebecca Meyer is an American mother who caught COVID-19 last month, March rather. She tells us she's been battling symptoms ever since.
It's important to know that this can happen to anyone. I'm 31, I was healthy, I was an active mom of 4, and now I don't get out of bed, I don't eat, I don't spend time with my children like I need to. This can happen to you, this can happen to your loved ones, and don't wait for it to hit close to home to take it seriously.
Now, some of the symptoms experts are mentioning include severe fatigue, headaches, and what they're calling brain fog and neurological issues. In a recent survey from the Body Politic COVID-19 support group, more than 3,700 people described themselves as what's being called long haulers, and nearly half couldn't work 6 months after their long-term symptoms developed. Dr. Alison Nabors joins me now from New York. She's an assistant professor at the Icahn School of Medicine at Mount Sinai. Doctor, thanks so much for being with us. This is a huge problem. A lot of people are concerned that these long-term COVID sufferers are potentially a serious long-term issue globally. How worried are you, and how many patients are you seeing at the facility you're at?
Yes, well, thank you for having me. And I definitely think that this is a topic or area that we need to be concerned about and focusing more attention on. At our post-COVID center in New York City, which was, I believe, the first one in the country to open up, we've seen about 1,400 patients so far, or 1,400 intake visits, and then 60% of those patients have been referred to neurology, which is my subspecialty. And we're in the top 3 referrals along along with cardiology and pulmonology, which receive a little bit more than 60% of referrals. And I know there's many more people on the waiting list to get in. So there's quite a demand for this specialty clinic in our services.
Yeah, I mean, the Lancet Medical Journal, I'm sure you're familiar, they recently published a study of hundreds of patients 6 months after hospitalisation. 76% of them still had at least one symptom months later, and you touched on a couple there, neurological issues, what they call brain fog, but lung issues. What are the most common symptoms you're seeing?
I think the number one most common symptom is really fatigue, and that sort of spans multiple specialties. Following fatigue, it's probably respiratory issues, so shortness of breath or decreased exercise tolerance. We're also seeing cardiac symptoms like chest pain or palpitations, heart rate fluctuations, and blood pressure fluctuations. And then neurologically, as you mentioned, the brain fog or cognitive changes is the number one thing that we're seeing, and followed by headaches and disturbance of skin sensation.
It's very worrying. I mean, one report suggested perhaps as many as 10 to 15% of people who'd had COVID have lingering effects. I mean, if there's 25 million positive tests in the US, 100 million globally, that is a massive number of people impacted going forward. What do you see the impact on, health systems and so on?
I think it's a major impact and something that we need to be on the lookout for. As many hospitals right now are being overwhelmed with patients with active COVID infection, but many of our patients with post-COVID symptoms are still requiring, ER visits with their chest pain or shortness of breath. They're seeing multiple doctors in different specialties. It's requiring a lot of diagnostic workup, different tests. And so it's definitely sort of adding another stress to the healthcare system, and something that we need to sort of learn more about and understand what's going on.
Yeah, one interesting thing that I read, and correct me if I'm wrong, it seems that the likelihood of developing these lingering symptoms is not related to the severity of symptoms necessarily, and it's actually quite common in younger individuals. Are you finding that?
Absolutely. So a lot of my patients are younger. I'd say the majority of my patients were not hospitalized, so they would have what we would call mild COVID, just meaning they didn't require hospitalization. Many of them were previously healthy, so this is not something we're seeing with the people who were sick and in the ICUs with multiple other medical issues going on. It's interesting, this post-COVID syndrome, it's really created a whole new medical specialty, hasn't it, which is what you're involved in. How surprising was that to you, and what sort of collaboration are you seeing around the country or for that matter, the world? I think it's been very surprising. I know when I started at the post-COVID center, I had been working in the hospital taking care of patients with active COVID infection and seeing how sick they were, how many complications they had, and really expected at the post-COVID center to be seeing those hospitalized patients following up those complications. And I don't think anyone, certainly not myself, expected to see so many people who had had milder infections, to see all the different symptoms that we are seeing. And I think it's been really great having the post-COVID center open up, and I know many other centers around the country have opened up. I think the multidisciplinary approach is really critical. I could not take care of these patients on my own. I really need the assistance of my colleagues in pulmonology, cardiology, physical therapy, and physiatry has been absolutely critical. So I really think that we're going to see more and more multidisciplinary post-COVID centers opening up around the country.
Wow, it's extraordinary. It started off, it was a few Facebook groups of people having these symptoms, and now we're seeing what you're involved with, and which is great to see. It's sad to see the symptoms, but great to see what's being done. Dr. Alison Navis, thank you so much. Appreciate what you do.
Thank you. It's a pleasure being here.